Assalamualaikum and hi to our respectful lecturer. So today we would like to present about one of the topic that have been given to us, which is autoimmunity and some of the autoimmune disease. I am Zubaida binti Nizar with the metric number F18B0252. Would like to start it with the introduction. So, what is autoimmunity? Autoimmunity defined as a condition where the body's immune system are failed to recognize their own cells and tissues that further lead to the self-destruction of the body. The autoimmunity happens when the autoantibodies and autoreactive T cells are reacting with autoantigens that produced by our own body. Based on the graph of the general population by the age and the gender, stated that women are more prone to autoimmunity compared to men according to the anti-nuclear antibody test, which is called as ANA. However, the result does not mean that they are prone to autoimmunity disease. So now we go to the autoimmune disease. Autoimmune disease are developed when the autoantibodies and the T lymphocytes in our body cause a damage to the organ or tissue that contain the autoantigen. So, the autoreactive lymphocytes are the actual cause of the immune disease. Some autoimmune diseases are targeted only on one organ, or some may affect whole body, such as systemic lupus erythematosus, which is only known as SLE. According to 2014 studies, some of the autoimmune diseases are commonly found in ethnic groups, which is lupus or SLE are commonly found in Hispanic people and African American people more than Caucasians. But this theory from the researcher are not been proven yet. Some of the causes may come from the environmental factors, which is come from the infection and the exposure of the chemical or solvents around surrounding. And then second, the Western diet. People nowadays are consuming such high fat, high sugar, high processed foods, which is not good for our body. Next is hygiene. Children nowadays are protected by vaccines and antiseptic, unlike before, years ago.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nuruddin Fadlin binti Alias and my metric card number is F18A0186. I'm going to present about rheumatoid arthritis, which is an autoimmune disease that can cause joint pain and damage throughout our body. Rheumatoid arthritis is a chronic systemic inflammatory disease that affects the hands and feet. Maybe involve any joint line by a synovial membrane. However, an extra-articular involvement of organs such as the skin, heart, lungs, and eyes can be significant. Next, the causes of rheumatoid arthritis. The causes of rheumatoid arthritis is unknown, but there are some factors that may increase the risk of rheumatoid arthritis. First is being a woman. Rheumatoid arthritis is more common in women than men, which may be because of the effects of the hormone estrogen. After that, factors that may increase the risk of rheumatoid arthritis is having a family history of rheumatoid arthritis. Other than that, factors that may trigger onset of rheumatoid arthritis involve exposure to certain types of bacteria, such as those associated with periodontal disease. Second, having a history of viral infections, such as the Epstein-Barr virus, which causes mononucleosis. Third, having trauma or injury, such as bone breakage or fracture, dislocation of a joint, and ligament damage. Next, some evidence suggests that people who smoke have an increased risk of developing rheumatoid arthritis. And the last one is people that having obesity. Next, the symptoms of rheumatoid arthritis. The symptoms often develop gradually over several weeks, but some cases can progress quickly over a number of days and vary from person to person. There are three major symptoms of rheumatoid arthritis. First is joint pain. It is usually a throbbing and aching pain. It is often worse in the mornings and after a period of inactivity. Second is swelling. It inflames and becomes hot and tender to touch. In some people, firm swellings called rheumatoid nodules can also develop under the skin around affected joints. Third is stiffness. Stiffness is also often worse in the morning or after a period of inactivity. There are some additional symptoms such as tiredness and a lack of energy, having a high temperature, sweating, a poor appetite, and having weight loss. After that, diagnosis. Rheumatoid arthritis can be difficult to diagnose because many conditions cause joint stiffness and inflammation, and there's no definitive test for the conditions. First, seeing a general practitioner. Seeing a general practitioner will do physical examination by assessing the physical ability such as checking our joint for any swelling, and the general practitioner will ask for the symptoms that we're having. After that, the blood test. The general practitioner may arrange blood tests to help confirm the diagnosis. There are three main blood tests include. First, erythrocyte sedimentation rate, ESR, which can help assess levels of inflammation in the body. Second is C-reactive protein, CRP, another test that can help measure inflammation levels. And third one is full blood count. These tests can be used to help rule out other possible causes of your symptoms as well as provide an indicator of our general health. The last one is magnetic resonance imaging or MRI scan. It can help to tell the difference between types of arthritis and can be used to monitor how the condition is progressing over time and also assessing our physical ability. There are several treatments for rheumatoid arthritis, such as disease-modifying anti-rheumatic drugs, DMARDs, work as blocking the effects of the chemicals released when the immune system attacks joints, which otherwise could cause further damage to nearby bones, tendons, ligaments, and cartilage. Next is biological treatments. It's usually only used if the DMARDs have not been effective on their own. And the biological treatments is given by injection and work by stopping particular chemicals in blood from activating the immune system to attack the joints. The last one is Janus kinase, JAK inhibitors. It is offered to people who cannot take DMARDs or biologicals or tried them but found they were not effective. This medicine is taken as tablet once or twice a day and is usually used in combination with methotrexate, which is drug in DMARD. The other treatments are painkiller, non-steroidal anti-inflammatory, steroids, physiotherapy, occupational therapy, and podiatry. Rheumatoid arthritis can put us at higher risk of developing other conditions, particularly if it's not well controlled, such as carpal tunnel syndrome, caused by compression of the nerve that controls sensation and movement in the hands in the median nerve. After that, widespread inflammation. Inflammation of the lungs or lung lining can lead to pulmonary fibrosis, which can cause chest pain, a persistent cough, and shortness of breath. While in heart, inflammation of the tissue around the heart can lead to pericarditis, which causes chest pain. Inflammation of the eyes can lead to scleritis or Sjogren's syndrome. Scleritis can cause eye redness and pain, whereas it can cause dry eyes. And the last one is cause inflammation in blood vessels, known as vasculitis. Is the thickening, weakening, narrowing, and scarring of blood vessel walls. In a serious case, it can affect blood flow to your body's organs and tissues and can be life-threatening.
Juvenile idiopathic arthritis (GIA) is an arthritic condition that mostly affects children. Arthritis causes joint swelling, inflammation, and discomfort. GIA is arthritis that lasts at least 6 weeks and affects one or more joints in a child ages 16 or younger. GIA is normally outgrown by children, unlike adult rheumatoid arthritis, which is chronic and lasts for a lifetime. In a growing baby, however, this disease can stifle bone formation. Causes like adult rheumatoid arthritis, TIA, is autoimmune disease. This means the body immune system attacks its own healthy cells and tissues. GIA is caused by several things. These include genes and the environment. The mean disease can run in family but also can be triggered by exposure and to certain things. GIA is linked to part of gene that calls HLA antigen DR4. A person who this antigen may be more likely to have the disease. Type: systemic onset GIA. This type affects one or more joints. This is often a high fever and skin rashes. It also may cause inflammation of internal organs, including heart, liver, spleen, and lymph node. It leads to common type. It affects 1 in 10 to about 1 in 7 children with GIA. Second is GIA oculoarticular. During the first 6 months of the disease, this type affects 1 to 4 joints. These effects called persistent if no more joint affected after 6 months. It's referred to extended arthritis if more joints are damaged after 6 months. Third is entitis-related GIA. With this type, a child has arthritis as well as entitis. This is a swelling of tissues where bone meet a tendon or ligament. It often affects the hips, knees, and feet. Third, GIA. This type affects 5 or more joints in the first 6 months of disease. Blood test for rheumatoid factor RF will show if this type is RF positive or negative. Post-arthritic arthritis. With this type, child may both have arthritis and a red scaly skin called psoriasis, or a child may have arthritis and 2 or more of the following. First is inflammation of a finger or toe, pits or ridges in fingernails, a first degree relative of psoriasis. Symptoms may occur at the time during an episode, flare up, they may also ongoing, chronic. The symptoms are differ from children to children. Their symptoms are including as following. First, swollen, stiff, and painful joint in the feet, knees, hands, ankles, shoulders, elbows, and another joints, often in the morning or after a nap. Second, eye inflammation. Third, warmth and redness in a joint. Fourth, less ability to use one or more joint. Fatigue, decreased appetite, poor weight gain, and slow growth. High fever and rashes in systemic GIA. Swollen and lymph node in systemic GIA. These signs and symptoms may mimic of other illness. Have an appointment for your kid to visit his or her doctor for a diagnosis. Treatment: non-steroidal anti-inflammatory medicine and NSAID to reduce pain and inflammation. Second, disease-modifying anti-hemorrhagic medicine DMARDs, such as methotrexate to ease inflammation and control GIA. Corticosteroid medicine to reduce inflammation and severe symptoms. Medicine called biologics that interferes the body with inflammatory response. They are used to other treatments isn't working. Lastly, talk with your child healthcare provider about the risk and benefit and possible side effect of all medicines. Other treatment: physical therapy to improve and maintain muscles and joint functions. Occupational therapy to improve ability and to do activity of daily life. Next is nutrition counselings. Fourth is regular as eye exam to find early eye changes from inflammations. Next is regular exercise and weight control. Next is getting enough rest. Last but not least, learning to use large joints instead of small joints to move and carry things.
Assalamualaikum and hi. My name is Aina Amirah binti Ahmad Rizal. Matric number F18B0009. Today, I'm going to talk about systemic lupus erythematosus or SLE. SLE is the most common type of lupus with severity range from mild to life-threatening. The SLE symptoms is tricky as it may be a symptoms for other disease. Not all affected people will have the same symptoms, medication and treatment. SLE affect women more than men with severe symptoms during pregnancy and menstrual period. Not to worry, pregnant women with SLE can have a normal pregnancy and healthy babies, but they are considered as a high-risk pregnancy. The cause of SLE. The exact cause of SLE is unknown, but the doctor have give out the factor that associate with the disease. They are genetics, environment such as UV rays, medications, viruses, physical or emotional stress, trauma, and the last factor is sex and hormone. The symptoms of SLE. They are various such as joint pain or joint swelling, severe fatigue, headache, rash on the cheeks and nose that may form such as butterfly look on the face, hair loss, anemia, blood clotting problems, and Raynaud's phenomenon. Raynaud's phenomenon is a situation where the infected person fingers turning blue or white in the cold weather. As for diagnosis, they also doesn't have exact diagnosis to detect the SLE, but the doctor usually run a blood test such as antibody test and complete blood count. The doctor also will do a urinalysis and chest x-ray. Treatment. There are no cure existed yet, but the treatment is done to ease the symptoms, and it all depends on the severity and the affected part of the body. Usually, the doctor will give anti-inflammatory medication, steroid cream for the rashes, corticosteroid to minimize the immune response, and anti-malarial drugs for the skin and joint. Last but not least, the effect of SLE. The effect is different from one people to another. There may be inflammation of blood vessel, pericarditis, heart attack, stroke, memory changes, behavioral changes, kidney inflammation, and kidney failure. That's all from me. Thank you.
Next, the autoimmune disease or psoriatic arthritis. Do you know psoriatic arthritis affects about 30% of people with psoriasis? However, not everyone who has psoriasis will get psoriatic arthritis, even though the conditions are often related. For the introduction, psoriasis and psoriatic arthritis is an autoimmune condition. What are the differences between the psoriasis and psoriatic arthritis? Psoriasis are the immune system targets the skin, causing inflammation and rapid growth that leads to those uncomfortable, itchy rashes. It causes patch of scaly, red, or white skin called plaque, while psoriatic arthritis are chronic condition where joints, ligaments, and tendons come under attack by immune system, leading to pain, swelling, and stiffness that can do serious joint damage. There are 5 types of psoriatic arthritis, which is symmetry psoriatic arthritis, asymmetric PSA or psoriatic arthritis, distal interphalangeal predominant PSA, spondylitis PSA, and psoriatic arthritis mutilans. What are the causes of psoriatic arthritis? It is when body immune systems begins to attack healthy cells and tissue. The abnormal immune response causes inflammation in joints as well as overproductions of skin cells. It is not entirely clear why the immune system attacks healthy tissue, but it seems likely that genetic, age, and environmental factors play a role. For the genetic, scientists estimate that at least 10% of the general population inherits one or more of the genes that create a predisposition to psoriasis. For age, it can start at any age and may affect children also, but the disease often appears in adults between the age of 30 and 50. Lastly, it is caused by environment. It happens because when someone stressed, injury, some people may develop psoriatic arthritis in a joint after an injury, trauma, smoking, or unhealthy lifestyle. What are the symptoms of psoriatic arthritis? Psoriatic arthritis can develop slowly with mild symptoms or it can develop quickly and severely. The common symptoms are joint pain and swelling that comes and goes, eyes inflammation which cause redness around the cornea, pain and stiffness in the lower back and neck also known as spondylitis, psoriatic arthritis, swelling in toes and fingers, pitted nails or separations of nail from nail bed. Many people with psoriasis arthritis have nail psoriasis. Thickness and reddening of the skin with flaky, silver or white patch, same as psoriasis. How psoriatic arthritis is diagnosed? Unfortunately, there is no definitive diagnostic test for psoriatic arthritis. The diagnosis is made mostly by doctors' observations and by a process of eliminations. Doctor will perform a physical exam which will include a medical history to determine if psoriasis or psoriasis arthritis runs in our family and may perform a blood test, MRI, and X-ray. Lastly, the treatment for psoriatic arthritis is non-steroidal anti-inflammatory drugs. It is usually the first step for mild psoriatic arthritis. It can help control the inflammation and joint pain. The most common NSAID are ibuprofen, naproxen, aspirin, and nebumetan. These drugs are not recommended for long-term use since they carry side effects like stomach irritations and kidney damage. Next, the treatment for psoriatic arthritis is disease-modifying anti-rheumatic drugs. It can be taken orally and methotrexate is also available as an injection. The most common are methotrexate, sulfasalazine, and leflunomide. These treatments work by suppressing the body's overactive immune system. The side effects like mouth sore, infections, fatigue, or liver damage. Next, the tumor necrosis factor 10F inhibitors can treat the person who have psoriatic arthritis. This meds lower inflammations and slow the progressions of psoriatic arthritis by targeting an inflammation causing substance in the body. Examples such as Remicade, Abril, and Humira. Lastly is corticosteroids. It is short-term fix for symptoms while waiting for others long-term medication to take effects. It can be taken orally, intramuscularly, or injected right into joints. The common corticosteroids is deltasone, prednisone.
Hi and Assalamualaikum. I am Nur Fariza binti Muhammad Sabri, matric number F18B0308. I would like to present about inflammatory bowel disease, also known as IBD. Inflammatory bowel disease is one of autoimmune disease which represent a group of intestinal disorders that cause a prolonged inflammation of the digestive tract. IBD can be classified into two types. First, Crohn's disease. This type of IBD is characterized by inflammation of the lining of the digestive tract, which often can involve the deeper layer of the digestive tract. It also can affect any part of the GI tract, means from the mouth to the anus. Second, ulcerative colitis. This condition involves inflammation and sore along the superficial lining of large intestine and rectum. IBD is a disease with an unknown cause. Some agents like bacteria, viruses and antigen might trigger the body's immune system to produce an inflammatory reaction in the GI. Recent studies show some combination of hereditary, genetic, or environmental factors may cause the development of IBD. Next is symptom. Symptom of both IBD vary depending on the location and severity of inflammation, but they may include diarrhea, bleeding ulcers, stomach pain, cramping and bloating, weight loss and anemia. People with Crohn's disease may also get canker sores in their mouths. Sometimes ulcers and fissures also appear around the genital area or anus. IBD can also be associated with problems outside the digestive system, such as eye inflammation, skin disorder, and arthritis. Next, I'm going to talk about the complication of IBD. Ulcerative colitis and Crohn's disease have some complications in common, such as colon cancer, skin, eye and joint inflammation, medication side effects, primary sclerosing cholangitis, and blood clot. Somehow, the complication of both IBD are not same. The other complication of Crohn's disease are anal fissure, fistulas, malnutrition, and bowel obstruction. And the other complication of ulcerative colitis is severe dehydration, a hole in the colon, and toxic megacolon. And lastly, we go to the treatment of IBD. There are several different methods for IBD. And lastly, we go to the treatment of IBD. There are several different treatments for IBD. Firstly is medication. Anti-inflammatory drugs are the first step in IBD treatment. These drugs help decrease inflammation of the digestive tract. However, they also have a side effect. Second, lifestyle choices. Drinking plenty of water might help. Avoid dairy product and stressful situation. Exercise regularly and quit smoking. Next, supplement. People with IBD may consume vitamin and mineral supplements. And the last treatment is surgery. Surgery can sometimes be necessary for people with IBD. Some IBD surgeries include strictureplasty to widen a narrow bowel, closure or removal of fistulas, removal of affected portion of the intestine for people with Crohn's disease, and lastly, removal of the entire colon and rectum for severe cases of ulcerative colitis. I think that's all from me, Nofariza, and thank you for your attention.